to this segment on our channel called Answering Your Most Googled Medical Questions by Cardiovascular, and today's video is a super interesting one. So let's get started. So in today's video, we'll be answering the question, what are 10 signs of an unhealthy heart? So cardiovascular disease is the #1 cause of death globally, taking an estimated 17.9 million lives each year. Cardiovascular diseases are a group of disorders of the heart and blood vessels, which include coronary heart disease, cerebrovascular disease, rheumatic heart disease, and other conditions. And cardiovascular disease claims more lives than all forms of cancer combined. So here are 10 signs of an unhealthy heart. #1 is aching in the shoulder and chest. So chest pains, especially on the left side near the heart, have long been a sign for a potential impending heart attack. The pain is caused by the death of heart muscle cells. Tightness and strain on the heart can sometimes be so painful that the pain can make its way up to the upper torso, especially to the shoulder area. This is called angina, which is associated with pain directly related to the irregular and interrupted flow of blood to the heart. #2 is irregular heartbeats. So an irregular heartbeat, also known as an arrhythmia, means that your heart isn't pumping blood at its normal rhythm. An irregular heartbeat is also an indication for heart failure or an impending heart attack. Arrhythmias is caused by the interruption of the electrical system that controls the heart. There are many different types of arrhythmias, including atrial fibrillation, atrial flutter, and premature ventricular contractions, to mention a few. #3 is shortness of breath and fatigue. So blood vessels can get backed up with blood due to an unhealthy heart, and this backed up blood can start spreading to places it shouldn't be, like the lungs. This causes shortness of breath. So breathlessness may occur during vigorous activity, which is most commonly, or sometimes in more severe cases during rest or even while some patients are sleeping. #4 is dizziness and lightheadedness. So feeling dizzy or lightheaded and even fainting may be a sign that blood flow to the brain is restricted, which is the leading cause for strokes and heart attacks. The dizziness and fainting can also be caused by a drop in the patient's blood pressure. #5 is puffy legs and feet. So swelling of the legs and the feet are caused by the improper flow of blood back to the heart. This is because blood isn't flowing out as it should and also isn't flowing back in properly as it should. This causes blood to clot up or may even completely stop the heart from working. #6 is snoring and sleeping problems. So there's a strong link between snoring and sleep problems like insomnia and sleep apnea and heart disease. Episodes of sleep apnea cause sleepers to wake up gasping for air, which can cause inconsistent sleep patterns. Heart disease have been directly linked to disruptions in breathing while people are sleeping. #7 is a persistent cough. So persistent cough is not always a sign that your heart has a problem, but it can occur in some individuals. So when the heart is not able to pump efficiently, this causes blood to back up into the veins that take the blood through the lungs, which in turn causes the fluid to build up in your lungs, causing irritation, shortness of breath, and a persistent cough. #8 is you'll get exhausted easily. So as your heart works overtime, it can cause tiredness, shortness of breath, and a feeling of simply being worn out, such as the signs of fatigue, which is actually one of the most common symptoms of congestive heart failure. #9 are bouts of cold sweats. So sweating, especially cold sweats, may be a sign of a problem with your heart when you're not doing any sort of physical activity, particularly when there's chest pain associated with it. The sweat may come from your body trying to cool down the inflammation around the heart. And finally, #10, which is pain that spreads to the arm. So another classic heart attack symptom is pain that radiates down the left side of the body. It may feel like a pressure or squeezing sensation, and heart attack pain almost always starts from the chest and moves outwards to the left arm, shoulder, jaw, and back. And that brings us to the end of this video. Thank you guys so much for watching. If you'd like to see more videos like this, please make sure to give this video a thumbs up, comment, subscribe, and share this channel with some of your mates. It really will help the channel grow. And if you would like to help us make better videos like this, you can also donate to us via PayPal. Take care and bye for now.